At Fox 24, we are committed to bringing you all of the latest facts about COVID-19. Tonight, Chad Mira with our sister station, KNWA, is talking with a local doctor on how to keep your family safe.
Joining us once again, Dr. Gary Berner with Community Clinic NWA. Dr. Berner, thanks for your time. How are things going today?
Absolutely. Things are going well. I appreciate you asking. Busy day at Community Clinic.
Well, let's start off because I've noticed over the weekend I tend to see more and more people around town wearing gloves and masks. The masks, of course, one of the latest recommendations we've been hearing from healthcare professionals. So on this topic, how often should we be changing our masks, or if it's a cloth mask, how often do we need to be cleaning them?
Yeah, great question. I think the masks are a great thing to cover. I think it's really important to cover the benefits of the mask. The mask may help us some in protecting ourselves. The masks are really important too in prevention of the spread, and that's probably where the key thing on the mask is in prevention of possible spread. So let's say you are positive and you don't even realize it. Maybe you haven't developed symptoms yet, or maybe you're not someone that would ever develop symptoms. And so if you're wearing that mask, it's really important for preventing that spread of the virus. It can do some benefit in terms of, protection for yourself, but really it's kind of for that public good at preventing the spread, especially if you have symptoms. And that way, if you're to cough or to sneeze, it's contained into the mask. And then even just your breath and speak out. That's why those masks have become so important. In terms of how often to clean those masks, if it's a cloth one, I would think about trying to clean it daily. And so you maybe have 2 or 3 that you can kind of keep in rotation and going through and washing. If you were to have a big sneeze into it, I would go ahead and change it after that time. Another reason that those masks are really helpful is we don't really touch our face when we're wearing them. We don't touch our mouth. We're more intentional in thinking about our hands, touching our nose, and touching our face when we have that mask barrier. So that's kind of another reason those are really helpful. For the gloves, I really like to preach more about hand hygiene than specifically about gloves. So whether it's gloves or whether it's washing your hands, we just need to be really conscious about what those gloves have touched or what our hands have touched. If we're wearing gloves and we're just going about our business, we could still take that from the glove and then touch another surface later that you or somebody else touch. So it's really more thinking about how often we're washing our hands and how often we're changing our gloves. And so I'd like to think about washing your hands or changing gloves with each environmental change. And so if you've gone from your home to the car and gone out to the grocery store, let's change them before getting to the grocery store. And if you go into the grocery store, I would change them after the grocery store. In that same sense, that's how often I want you washing your hands.
Okay, let's stay on the topic of cleanliness here for a second. We know we should be constantly disinfecting, especially some of the more commonly used items and things around the house, doorknobs, things of that nature. But what else around the house should we be focused on? What kind of surfaces should we watch out for? Should we even be, changing the bed sheets often? Or what about the couch? Can COVID-19 live on those items?
Mm-hmm. Yeah, in a lab, in perfect conditions, COVID-19 can live on cardboard. I've seen that reported up to days. Can live on certain surfaces for definitely for hours. The number one surface that I want you to think about keeping clean is your hands, because that's where that's going to spread from. You're going to sneeze into your hand and touch a doorknob, or you're going to touch a surface and then later touch your sandwich and then consume that. So that's the number one thing I want you to think about. Number 2 would be anything that you're eating. And so, where has that food been? Where has that plate been? That's going from kind of hand to mouth there. And so thinking a lot about the, potential for food consumption, that type of thing. Lower on that list would then be tables and surfaces that are kind of open for breath or for a sneeze to land on. I would definitely want to, those open surfaces, clean those a little bit more often. And then further later down the list would be, your bed sheets, couches, and clothes, that kind of thing. I don't think we have to take our couch cushions to the dry cleaner on a daily basis by any means. I think the key thing there is thinking about your hand hygiene and touching your face. Even if COVID-19 was potentially on your couch for a short period of time and you touched it, which is really not the high-risk exposure that we're thinking about, if you don't touch your face, if you wash your hands frequently, then that wouldn't pass to you. So I'd like to think about bed sheets and couch cushions as a little bit lower risk, and really thinking about our own body and that exposure as really the high risk. Who you're living with and the symptoms that they have is that high risk, that a potential droplet could come from speech or a sneeze and be that high risk exposure.
Leslie, tonight I want to talk a little bit about interpreting some of the data we've seen. Obviously, we report new cases every single day. Today, we saw the largest single-day increase of COVID-19 in the state. But the past couple days, the increases were much lower. So any advice for people, sitting at home? It's hard for us to look at this and say, okay, we had one bad day, things might be getting worse, or we had one good day, things maybe are getting better. How should we be looking at these numbers when we're trying to figure out what's going on here?
That is an excellent question. You can really get lost in trying to look at the day-to-day numbers. I think a better way to look at how is Arkansas doing, how is my county doing, is looking probably week to week. There's a lot of factors that go into those day-to-day numbers. When was that lab tested? When was it sent in? And then when does those results come back in? And so could some of those numbers be affected by were things slow over the weekend and then we had a big jump in on Monday morning? Or were there a lot of tests sent on Friday afternoon and so then they were all resulted on Sunday? A lot of factors that can go in to impact those day-to-day numbers. But spacing it out, maybe looking on a week basis, probably gives us a much better idea of how Arkansas or how Washington or Benton County are doing in terms of increasing infection rates, increasing death rates, those pieces that we're also concerned about.
Very good. That's all we have for you tonight. Dr. Berner, once again, thanks for your time and stay healthy over there.
Hey, I sure appreciate it. Same to you guys. Take care.